2, 1.
Welcome back to Room 1221 Live. You already know, if you're looking for experts' advice or information on anything sexual, reproductive health related, this is where to find it. Today, we're talking about breast cancer. And I've got with me two incredible men who are very passionate about women's health, Dr. Darko and Dr. Isaac. Dr. Darko and Dr. Isaac, could you please introduce yourselves to us?
My name is Dr. Darko. I'm a physician assistant. I work at Ghanaian Municipal Hospital, and I was a right operation. And I'm happy to be here to talk about women's health.
We're happy to have you here too. Welcome. So, Dr. Isaac, please introduce yourselves to us.
My name is Isaac Boamadango. I work as a nursing officer at Obuju Polyclinic and then at Yeboah Hospital.
Wow. Okay.
I'm doing this.
Welcome. It's awesome to have you both here with us today. So, yes, we're talking about breast cancer. Let's get straight into it. Dr. Darko, what exactly is breast cancer?
Okay, so I think we'll take it from what cancer is. We can now talk about breast cancer.
Yes, please.
So, cancer is usually a disorder where, body cells are formed in such a way that they grow to a particular extent and then they die off and then they regrow. That's how cells work. But the issue with cancer is they don't stop growing. They keep growing and they grow and grow and grow into a tumor or a cancer. So that's where the difference is. So we have one that is benign. That's what we call the tumor. And that's where you usually see where there's like a huge mass. I don't know, a bulge or whatever it is. At whatever region. So let's say you have a brain tumor. That's like a mass or like a mass in your brain. But with the issue with cancer is it doesn't just form a mass. It goes on to infect other cells in the entire body. Yeah, so instead of it affecting, let's say you have a brain tumor, it will travel all the way into the lungs, into your chest or wherever it is, and infect the other cells. That's the issue with cancer. That's why cancer is so dangerous, whereas tumor is less dangerous. So as the name implies, breast cancer is a cancer of the breast, which means that the mass over there or the disease can spread to other areas. And that's what bleeds about the 4 stages of cancer or the 5 stages of cancer. So that's what really breast cancer is about.
Okay. Thanks. I didn't know it was that
deep.
Yes. Dr. Isaac.
Yes.
What would you say some causes of breast cancer are?
So the causes of breast cancer, So the causes of breast cancer, we have 1, lifestyle changes. We have 2, hormonal therapy. That is with when you have other conditions and you are being put on hormone therapies. That has specifically introduces estrogen into your system. It brings it up and then they turn as receptors to your cells and then that also gets the cancer out. Yeah. And then we have genetics. Okay. So when you have a family history of someone, a sister or a mother, a grandmother, anyone in your family, your line that got cancer, you have the efficacy of getting the cancer. When about mutation to the growth or the multiplications of cells. When you have cells, the person specifically has cells that mutate rapidly, grow rapidly. You could also have cancer, breast cancer, basically.
Would you say that everyone could be at risk?
Yes. Males and females, everyone has a breast tissue. But then there are excesses in females more than males. Yeah. Males have breast tissues, but theirs don't grow. But then there's growth in that of the females. That's why there are most cases of breast cancer in females more than males.
Okay. Yeah. Okay. Understood. Well noted. Thank you. So, Dr. Dako, back to you. What would you say the importance of early detection really is?
Very, very important. The whole survival of the female depends on that. That's actually what we depend on to treat a patient who has breast cancer. Because the earlier you detect it, the better. Because remember when I said cancer, they multiply. They multiply from one region into the other regions of the body. So that's the stage 5 of cancer. Call it metastasis. That's where you don't want to get to. At that point, it cannot be helped because the issue with cancer is it's the cells. There's no technology, right? The only technology available to treat such a thing is nanotechnology, and that is still being developed. So you don't want to get to a point where it goes so deep into like other parts of the body where they usually cannot separate it, right? But if let's say, so stage 0, right? It's called non-invasive. You find it in the breast tissue, right? But it has not even developed into a mass yet, or even if it has, just very little, right? Not even up to 2 centimeters.
Yeah.
At that point, it can be easily detected and taken out. If you do this screen, that's why the screening is important. If you do this screening, you see it. But you will not know. There will not be really any symptoms. Now you move to stage 1, you move to stage 2, 3, and at that point, you now realize the growth of the tumor happening. And that's when you now start to realize it. And most of the time, patients usually find it around stage 3, stage 4, maybe sometimes stage 2, right? Where they start to see lumps, they start to see a lump in their armpits or the axillary region, some pain, some discharge. That's when they start to notice it. And at that point, that's where you can only rely on chemotherapy and radiotherapy, sometimes mastectomy, which is the complete removal of the breast. It's past stage 4. It's stage 5, sorry. That's where you don't want to get to because the only thing that can help is supportive care. So the earlier, yes, that means
that's what you said.
It can't be helped. You just have to, we call it palliative care. So you take care of the patients, you make sure that patients reduce the pain the patients experiences. Try to make the patients as comfortable as they can be onto the person.
Oh, that's quite morbid, but also that is a reminder to us to check our breasts often. Right now, there's this wave where every October, most organizations, most workplaces talk about breast cancer awareness, and everybody's like, "Oh, let's do a health walk, let's do a health screening." Do you think that it is actually making some impact in terms of saving lives and early detection? I mean, both of you can take it, but Dr. Dako, Dr. Isaac, sorry, please.
Yeah, it is. Because us at last year, October, okay, that was the exercise that was conducted at my end at Yaba Hospital. We got like 2 cases of, we suspected it. So we asked them to go and do further investigations with the scans there, and mammograms and all that. But then fortunately enough, when the results came, the comments came, it wasn't a cancer. It was just a regular lump that was there. So I can say if they came and they were cancers, of course there was a detection. Yes. And then that would have been kept, right? Yes. So of course you are making progress with it.
Okay, that's great. Thanks for that.
I think it definitely has an impact. It reduces the probability or the occurrence of these things because for every point in time you have this screening with a particular population, you realize that you find certain people with these things. I've had cases where we've had to do a screening or just like a random check on this person, and then we find out that this person has like a cancer. They think it's just we have something called a fibroadenoma, which is the tumor, right? But it's a small lump and it doesn't really cause much of an issue. So sometimes females think that some people think that it's not a problem, but you will never know until you have the test done. And I remember one time we had this done for a patient, and we found out she was at around stage 3. Yeah, she was around stage 3. That was close to stage 4. Yeah, so she thought it was not, and then after some time realized it had gone so bad, and she was very devastated that was the case. Yeah, that was the case. So it helps. It really does. It helps detect these things early.
Okay, that's great. That's good to hear. So kudos to all the companies that do breast screening. Keep it up, and also if you have the opportunity to get your breast screened, don't hesitate. Take the opportunity and get your breast screened. It's good for you. Now, Dr. Darko, you mentioned screening, right? When we go for the screenings, sometimes it ends there, but I know that the screening is not the end of it. You have to do diagnosis and consultations and other things. What would you say to our listeners to do, or what are the steps to take from getting your breast screened? What's next?
Okay, so I think the best thing would be to go to a doctor. There are facilities that take care of, these screening techniques. Like they hold these screening programs and they tell you to come for screening. Okay, so they'll do that for free sometimes. So during breast cancer awareness month, for example, they hold a lot of it, so you can, go through that. But it's still best to go to a doctor. Yeah, I think the best thing would be if you find an issue, even if you don't, have a system where you can go to the hospital regularly for checkup. It's very important. Even if you can't go every month, every 3 months, at least let's say twice in a year at least. Because I know a lot of people don't go for checkup. So you go there, you have your screening done, you talk to the doctor. There are some things that's the job of the doctor. The difference between a regular citizen and a doctor is the doctor has more knowledge, has the knowledge to understand exactly what is going on and to guide you through it.
Yeah.
Right. We have been there for a long time to see like certain things, to make mistakes ourselves and to make corrections. So when these things come again, we see it and we can lead you in the right path. And it's possible you can go for the screen yourself, look at your own results and see that, okay, Google it. Oh, it's fine. But there will be certain symptoms you have that doesn't seem so much of an issue. The doctor will look at it and say, no, let's just do this, let's do that, and let's just confirm and everything is okay. And you'll be surprised to see that you get something out of it. Even if it is not something related to your breast or cancer or anything, you can find something else out of it. I've had so many cases like that. Yeah, they were living with something that they didn't even know they had.
Wow. Okay. So, yes, visit your doctor regularly. Now, Dr. Isaac, we have seen some self-check charts and things around. My question is, if I self-check and I find a lump or I feel something in my breast, one, could that mean that it's cancer? And two, should I be running to the hospital?
No, not any lump in your breast is cancer. It can be, as was said earlier, the tissues in your breast or the cells in your breast, they grow. So it can be a form of growth. That doesn't mean it's cancer, but then it's just your tissues growing. And then that doesn't mean you should also run, because you can't diagnose yourself and say, hey, I have cancer. No, you can't diagnose yourself of cancer. So if you find a lump there and then it's even if it's just a lump, not even if there's pain, if there are any discharges, if there is just a lump, it's best you take it to the hospital, get it re-examined, and then the next steps, whatever that is needed will be done.
Okay. Thank you. Now, I'm going to throw a very broad question to both of you. Should someone survive breast cancer and have gone through a mastectomy, right, and all these treatments, chemotherapy and all that, how does it affect their health overall?
if they've gone through the procedure.
Yes, or if you haven't, yes, you've recovered or you are currently having it.
How does it affect their health?
Yes.
I think mentally is where the issue is. Mentally.
Mm-hmm.
Because we've already gone through the process of dealing with the issue of the body, like internally. That's the whole reason for the procedure. So that has been dealt with. The issue is mentally. Because now you are a female without breasts. This is one of the markers of identity. And it's not there.
True.
This is something that a lot of females make the mistake of standing on to define who they are.
Yeah.
Right. And now that is gone, you now have to question your identity as a woman. So I think you have to rethink and reassess yourself and your identity as a person. Does this thing really define you and who you are? Are you worried about the validation of others, or are you worried about yourself and what you are as an individual? That's where it is. Mm-hmm. Because, okay, they are gone. You have to accept first and foremost. It's hard. It's a very hard truth. But first of all, be grateful about it, because you might not even have been here. And secondly, you have to know who you are as a person and know where you're going to. Your breasts, I'm sorry, I don't mean to sound very, but your breasts are not going to make you go there. Like, I know it's very hard to talk about, but your breasts it's not going to get you there. Right? So I think you have to also have a very good circle too. Some people will really be on your neck and be like, you're like a woman, you don't have breasts, and some of them will talk behind your back, some of them will not see it. Yeah, you have to have a good circle around you. Mm-hmm. So it's mental health at that point. You have to protect your mental health and reassess who you are and your identity as a person.
Yeah. Thanks, Dr. Dako. We'll come back to the support part. But Dr. Isaac.
I think Dr. Dako has said it all. If you are done with all the treatments, the cancer is off completely, and then you're home. It all bounces back to you, the person. How you, because the society knows a female to have breasts, like 2 breasts basically. Mm-hmm. And then when you look in the mirror, you have just one breast showing, and then the other part is flattened out because of this same thing. It's a sort of mental torture, because even if the basic things you are doing, even if you are buying clothes, even if you are thinking of, even if you are married and you are even thinking of pregnancy, you'll be like, what breast am I going to give to my child? Kind of thing. Even forgetting, say that breast is there that can even work. Mm-hmm. And even if you give birth, the production of milk, it all still revolves around the brain. And then if this thing is still on your brain, you are thinking about it, trust me, the milk is not going to come in the first place. For the kid to even suck it, and then for the production to even come in the first place, because of this thing you are still thinking about.
Wow.
Okay. So basically, because of that thing, you are going to be stressed out, basically.
Yeah.
And then that is also going to impede other areas of your life too. Your social life, your physical life, spiritual life, mental life, is all going to be affected because of that same thing.
Yeah.
So it's still revolving around the mental health, basically.
Okay. Yeah. So, in conclusion, you'd say that survivors would need strong support systems, and they also need to seek some help, mental health therapy, right? Okay. Thank you. So now moving on to prevention and screening, and then the support aspects of it. Dr. Isaac, how often should we get our breasts checked?
How often you should? Is it because of, if not for the yearly screening we do, mm-hmm. No one walks to the hospital and be like, I'm coming for breast screening. Mm-hmm. True. If it's not for October.
True.
But then ideally, you should do it every 3 to 6 months. It should be frequent as that. And then when you notice any change in your breast, if it's discolored, if it has gone bigger, if there's a discharge out of the nipple, if there's a lump, when you notice anything like that, the first thing you should do is take it to the hospital, and then you should do it as frequent as 3 to 6 months.
3 to 6 is
Yeah,
quite
so a space
frequent.
of 3, 6, and then 9.
3, 6, 9.
Yeah.
Okay. Thanks, Doc. Now, Dr. Dapo, when would you say the mammograms should come in? Or yes, when would you say they come in?
Mammograms are usually directed towards a particular age. So 40 downwards. 40. That's your mammogram comes in for. Yes, so usually older people. So if you're 14 above, mammogram comes in for them.
Okay.
But there are certain situations where younger people are do the mammogram, depending on what your case is. But usually it's usually 14 above. 14 above.
Okay. Now, would both of you say that there are accessible and available support systems for survivors and patients in Ghana?
I wouldn't say they are enough, even if they are. Because even me, I'm not seeing it. If I'm not seeing it, I don't think the citizens also see it.
Yeah, but there's a need for it, no?
There is. It's a very strong need.
Yeah.
It's a very strong, because it's not an easy thing. It's not an easy thing at all, to be very frank.
All right. If you're a therapist or you are into humanitarian aid, I've just found a gap in the markets for you. This is something you can do to help all the girls, all the women in Ghana. We really appreciate it. Now, to the last point of the conversation. Let me start with Dr. Dapo and I'll come to Dr. Isaac. But the same question or same thing. What is your final message, your final word of advice for all the girls, first of all, the girls or the women who are watching us, and then anyone who has survived breast cancer as well?
Okay, so let me just speaking to two audiences.
Yes.
Okay, so the first audience to anybody who has not had breast cancer before.
Yes.
Prevention is better than cure. Always look at your health, check your health, right? Know who you are as an individual, know your health, know if there are any risk factors. So, your family line, if there's anybody who has it or there's been an occurrence of it, watch your lifestyle and your development. Have a system where you can always track these things, and don't be scared. I know that talking about these things, you start to now overthink. Oh, I had this lump sometime. Oh, I had this pain. Take your time. Just take your time. Read around it. If you keep doing these things regularly, you're doing these checkups, you come to realize that after a year or two, you don't need to go to the hospital much again or have to worry about certain things. Your questions will start to change and your vision will start to change because you now understand yourself more. That's the way to go. So for the second audience who have had that issue, it's not the end of the world. Like, it's not too late. It's very tough. I know, it's very, very tough. Sometimes I don't feel like I have the right to speak to these people because they're the only people that go through this thing. But it still comes down to the fact that that's not the last show. That's not the end of it. And I think you still have something to fight for. So something to look at, a vision to look at, and things to acquire. And I think you should go for it. Try your possible best to go and get up and go and keep going. And you realize that it was never about that, but it was about something more than that. And you realize that there's more to life than just that.
Thank you. Dr. Isaac.
Okay, so to the first audience, people that have not experienced or have not had breast cancer before.
Yeah.
Just as Dr. Dapo said, take care of yourself. If you notice anything, the slightest thing you notice on your breast, just report it. It is better you report it, and then it's debunked that it's nothing. Than you sitting home, be like, oh, this one is just this one is just that. If I apply this, it will go. If I do this, it will go. And then it later turning into something that cannot be explained. That will be a problem. So anything you notice, please take it to the hospital and then take care of yourself. Now, to the second audience, those who have had breast cancer. I've not experienced it before, but from what I've seen and what I've seen people who have gone through it, what I hear them say, it's not easy. It's not easy. But then, as Dr. Dako said, that is not it. There are a lot of things. There is more to life than breast cancer itself. So, in fact, you're not alone. If you don't worry, if you have any worry, if you have anything, but you come to the hospital. Yes, you get sorted out.
Yeah. Okay.
All right.
Thank you, Dr. Isaac. All right. This has been quite the heavy conversation. I can't lie. But if you have any questions, don't hesitate to reach out to us on 1221, and we'll make sure that we connect you to our lovely doctors here. And it's been great having you guys join us on this episode as well. We'll catch you again on the next one. Goodbye.
Room 1221. Room 1221.